Does tapping EFT stimulate the vagus nerve? Have you ever wondered if tapping, known as emotional freedom techniques, can really stimulate the vagus nerve? This is an interesting question, especially for those dealing with PTSD and anxiety. Tapping involves gently tapping on specific acupressure points while focusing on distressing thoughts or emotions. There is some emerging evidence suggesting that this practice may engage the vagus nerve, which plays a crucial role in regulating our autonomic nervous system. The vagus nerve is a key part of the parasympathetic nervous system, often called the rest and digest system. When we stimulate the vagus nerve, it can help counteract the fight or flight response that many people with PTSD and anxiety experience. Techniques that activate the vagus nerve, such as vagus nerve stimulation, have been studied for their potential benefits in improving emotional regulation and reducing fear responses. Research indicates that tapping may stimulate the vagus nerve by combining gentle tapping with focused breathing and calming thoughts. This combination can promote relaxation and help shift our bodies from a state of stress to one of calm. This is particularly important for individuals with PTSD and anxiety, as it can aid in emotional regulation and resilience, helping to reduce hyperarousal symptoms. There is a specialized form of tapping called vagus nerve tapping, which emphasizes techniques that target the vagus nerve directly. Users of this method report benefits like reduced anxiety, improved stress management, and enhanced emotional processing. One study even noted an average 41% reduction in anxiety after just 9 minutes of tapping practice, showcasing its potential as a helpful tool for managing stress. While direct scientific studies proving that tapping definitively stimulates the vagus nerve in humans are still limited, the physiological mechanisms of tapping align with what we know about vagus nerve activation. Vagus nerve stimulation is actively being researched for its role in treating PTSD, often in combination with exposure therapy to help individuals process traumatic memories. In summary, tapping likely stimulates the vagus nerve indirectly through its combination of physical and emotional techniques, promoting calm and emotional regulation. This makes it a promising complementary approach for managing hyperarousal in PTSD and anxiety. However, it is essential to remember that tapping should not replace standard medical care. Instead, it can be considered an adjunct to professional treatment. Key points to keep in mind include that tapping involves gentle tapping on acupressure points while focusing on distressing emotions, which may engage the vagus nerve and promote relaxation. Vagus nerve stimulation is known to aid emotional regulation and trauma recovery, and tapping shares mechanisms that could activate this nerve. Specialized vagus nerve tapping techniques combine tapping with vagus nerve toning to support nervous system health and reduce anxiety symptoms. Studies have shown significant anxiety reduction with tapping, supporting its role as a non-invasive tool for managing stress and emotions. Always consult with healthcare professionals for personalized advice and treatment options.